Welcome to today's lecture on the comprehensive understanding of parotitis. Parotitis refers to the inflammation of the parotid gland, which can be caused by various factors such as viral or bacterial infections, autoimmune disorders, obstructions, and underlying medical conditions. Throughout this lecture, we will delve deep into the anatomy, etiology, pathophysiology, diagnostic approaches, management options, and preventative measures associated with different types of parotitis. To comprehend parotitis, it is crucial to have a solid understanding of the anatomical structure and function of the parotid gland. The parotid gland is the largest salivary gland, located in front of and below the ear. It plays a pivotal role in saliva production and secretion. Considering the gland's proximity to critical structures, any inflammation in the parotid gland can lead to discomfort and potential complications. This topic will explore the intricate anatomy in detail and emphasize the clinical relevance of its association with parotitis development. One of the most common causes of parotitis, particularly in children, is mumps. This topic will delve into the etiology and pathophysiology of mumps, a highly contagious viral infection caused by the paramyxovirus. Detailed discussions will include the modes of transmission, incubation period, clinical manifestations, complications, and the impact of immunization in preventing mumps-associated parotitis. Bacterial parotitis, although less common than viral parotitis, can result in severe complications if not promptly diagnosed and treated. This topic will explore the diverse microbial etiology responsible for bacterial parotitis, including Staphylococcus aureus and Streptococcus species. Furthermore, we will delve into the appropriate diagnostic approaches, including culture and sensitivity testing, to accurately identify and manage bacterial parotitis. Sjögren's syndrome is an autoimmune disorder characterized by dryness of the eyes and mouth due to the destruction of exocrine glands. This topic will focus on the impact of Sjögren's syndrome on the parotid gland, leading to autoimmune parotitis. Detailed discussions will include the underlying mechanisms, clinical manifestations, diagnostic criteria, and potential management approaches for this particular type of parotitis. Obstruction of the salivary ducts, often caused by the presence of calculi, silolithiasis, can result in obstruction of saliva flow and subsequent parotitis. This topic will explore the etiology, pathophysiology, clinical presentation, diagnostic modalities, such as silography and ultrasound, and various management options for silolithiasis-induced obstructive parotitis. Continuing the discussion on mumps-associated parotitis, this topic will delve into the epidemiology of mumps, including its global distribution, age predilection, and impact on different populations. Clinical features will be thoroughly explored, highlighting the characteristic swelling and potential complications. Additionally, we will emphasize the importance of vaccination strategies in preventing mumps and its associated parotitis. Accurate diagnosis of parotitis relies heavily on imaging modalities such as ultrasound and MRI. This topic will extensively discuss the advantages, limitations, and appropriate utilization of these diagnostic tools in assessing parotitis, including their ability to differentiate between viral and obstructive causes and identify potential complications. Parotitis in immunocompromised patients poses unique challenges in terms of diagnosis and management. This topic will explore the comprehensive approach required to address parotitis in this vulnerable population, including appropriate antimicrobial therapy, supportive care, and interprofessional collaboration. Necrotizing parotitis, although rare, is an extremely severe complication associated with significant morbidity and mortality. This topic will shed light on the underlying mechanisms, risk factors, clinical presentation, appropriate diagnostic methods, and the multidisciplinary management approach required to address this life-threatening condition effectively. Recurrent parotitis in pediatric patients can significantly impact their quality of life. This topic will focus on exploring the underlying causes, including congenital abnormalities, immune system dysfunction, and various predisposing factors. Diagnostic approaches and treatment options, including pharmacological and surgical interventions, will be discussed in detail. Parotitis-related complications in the elderly population are not uncommon and can have severe consequences. This topic will delve into the increased risk factors in the elderly, including polypharmacy, comorbidities, and immunosenescence. Additionally, effective prevention strategies will be emphasized, including oral hygiene measures, regular dental care, and vaccination. Patients undergoing head and neck cancer treatment often face challenges related to parotitis. This topic will explore the impact of radiation therapy, chemotherapy, and surgery on parotitis development. Furthermore, appropriate management strategies, including prophylactic approaches, will be discussed to mitigate parotitis-associated complications in these patients. In conclusion, The understanding of parotitis requires a comprehensive knowledge of its anatomical, etiological, pathophysiological, diagnostic, and management aspects. With insights gained from this lecture, medical professionals will be equipped to identify, manage, and prevent the various types of parotitis effectively, ensuring optimal patient outcomes.